The lighthouse is one of our province's most familiar and iconic symbols. It stands for clear vision and safe navigation, shedding light on both the big picture and the individual path. In the darkest circumstance, it can mean the difference between safety and danger, life and death. It has been the symbol for Eastern Health for many years, an appropriate one for healthcare, given the clarity of vision, direct communication, and safe care that are essential to the healthcare journey. Lighting the Way, Navigating Together is the name of Eastern Health's strategic plan that will chart our course between 2017 and 2020. The plan is a living document representing the men, women, and children we serve, but brought to life by every one of the 13,000 men and women who work at Eastern Health. The plan is founded on 5 strategic priorities, 5 guiding principles which govern both the big picture and the daily tasks, and by which we measure our progress. Access to care continues to be a key priority at Eastern Health, and the 3-year plan will focus on 3 objectives: improving access to child and adult psychiatry, as well as selected mental health and addiction services within the community; improving access to primary health care with a focus on chronic conditions; and improving access to selected community supports and long-term care. The wait for mental health and addiction services is of particular concern, so Eastern Health will increase efforts to improve wait times for clients. With that in mind, Eastern Health opened several single-session walk-in clinics in the spring of 2017. These clinics offer counseling services on a first-come, first-served basis to those who feel they need to speak to someone right away. This walk-in service is one of the ways in which Eastern Health is responding to the growing need for mental health support throughout the region. With a walk-in counseling service, there is no referral, no intake process, and no wait list. This is especially important in rural areas. Rural Newfoundland has much to offer: spectacular scenery and natural wonders second to none. But more often than not, mental health services are located elsewhere and can involve a wait list. The walk-in clinic in Ferryland on Newfoundland's southern shore is just one example of how that is changing. George Andrews is a mental health counselor who says the research indicates that single-session walk-in clinics offer most of their clients all they need.
The best way to capture that is within a 7-month period of offering the service, we had 76 people through. That's only 1 day a month with 2 clinicians, and only 13% required more services beyond the scope of single session. In my view, that's access. That's accountability. That's moving in the right direction.
Quality and safety is an integral priority for Eastern Health that's consistently woven throughout the entire organization. Between 2017 and 2020, Eastern Health will continue to work towards a caring and compassionate environment with a culture that encourages client and family-centered care, an approach to healthcare that is respectful, compassionate, and culturally appropriate. Eastern Health will continue to improve standards and processes, ensuring that facilities are well maintained to improve overall quality of service. And it will increase focus on safety as it relates to patients and clients, families, employees, and the general public. Just ask the folks in medical device reprocessing how important this is. Hundreds of employees across the region work tirelessly to ensure that every medical device, from scopes to surgical instruments, from breathing equipment to bedpans, is washed or sterilized, inspected, reassembled, and wrapped before being sent to the patient units or the operating rooms. Jennifer Cooper works at the Health Sciences Centre in St. John's. She and her colleagues follow written policies and standard operating procedures, monitoring and documenting their work every day, work they take very seriously.
First of all, we have to understand the principles of basic microbiology and infection prevention and control. to decrease the risk to both patients and staff during routine reprocessing procedures. As medical device reprocessing technicians, it is our responsibility to give incredible attention to detail and to reprocess the highest quality of medical devices that are used on our patients daily.
Improving the health of whole populations involves a long-term vision and commitment to navigate challenges and reach desired outcomes. Newfoundland and Labrador has some of the poorest lifestyle practices and health indicators in the country, which underlines the urgency to chart a new course. Part of the solution is refocusing attention on primary health care throughout the Eastern region and engaging with communities to improve the health of their populations. The strategic priority of population health takes this into account in its 3-year plan and will collaborate with partners on prevention and promotion initiatives to improve the health of the population and engage community members in new and existing initiatives aimed at improving the health of the population. The town of Bonavista and surrounding areas has undergone a social and economic revitalization in recent years. It's also been the site of a renewal process in the delivery of primary health care. Eastern Health works closely with residents and community leaders on the Bonavista Peninsula to provide primary care in the right place and by the right people to ensure the best possible health outcomes for the population.
It's really closely associated with good health. If we don't have good health care providers and good access to health care providers, then population health suffers.
Eastern Health has surveyed residents, conducted efficiency exercises in the emergency department, hired physicians and nurse practitioners, and implemented an electronic medical health record at the Bonavista Peninsula Health Centre, one of the first locations in the province to do so.
Electronic medical record gives you point-of-care access to the information that you need to manage a person's health conditions. So it tells you like their past medical history, their current active medications, allergies, immunizations, all of the information that you need, and it's accessible to all members of the primary health care team.
As the work continues in Bonavista, similar initiatives are underway on the Burin Peninsula and in downtown St. John's, as Eastern Health works with communities to develop new and improved models of primary health care. Eastern Health's greatest resource is its people, the employees, physicians, and volunteers who dedicate themselves to healthcare on a daily basis. Investing in employee and workplace health reaps important benefits in the form of productivity, high performance, and success. A healthy workplace has always been important at Eastern Health, but has now been formally recognized as a priority in the strategic plan. Its aim is twofold: to increase employee engagement and to promote employee wellness in the workplace, with a particular focus on mental health. Good mental health is closely linked with good physical health, and that's the idea behind a new gymnasium in the long-term care facility at Carbonear, one of several in the Eastern Health region. It's run by employees and paid for with membership fees. Nick Rossiter is an electrician with the Infrastructure Support Department. His job keeps him active. The gym keeps him healthy.
As you come in and work on your cardio, right? You got your eating down pat. Now you just gotta do more activities. Come to the gym, enjoy yourself, have a bit of fun with co-workers. You know you're working out if you're having that much fun. So it's right on site, one-stop shopping. There you go.
In order for Eastern Health to continue to improve access, quality and safety, population health, and the health of its own workforce, the organization must be sustainable. This means Eastern Health must continue to increase efficiencies and reduce wastage throughout programs and services. In recent years, one of the biggest concerns at Eastern Health has been the number of people who don't show up for clinical appointments. In a single year, that can add up to 190,000 missed appointments, or no-shows. This results in wastage and delays, as equipment lies idle and staff don't operate at full capacity, with no time to book anyone else. In 2016, an automated notification system was put in place to remind people of appointments they might otherwise forget by phone, text, or email. Piloted in the endoscopy service, it's helping to move things more efficiently and to ease any no-show backlogs.
Yes, did you want to reschedule your appointment? I can reschedule you for about 2 weeks' time on the 28th. Thank you so much for calling. Because you called and rescheduled your appointment, now someone else can have your appointment time.
Fewer empty chairs in waiting rooms, fewer empty beds in procedure rooms, and less idle equipment all adds up to a more efficient and effective healthcare system, according to Christina Cole, a manager in healthcare data and management technology. She says plans are underway to expand the automated notification system to other programs and services.
It gives Eastern Health the ability to sustain their services in the future. It also reduces no-show rates and wait lists, better utilizes resources, and along with that, it also reduces cost within Eastern Health. And this way, helping the organization as a whole and also helping the patient get a better patient experience.
What you see in this video are just a few examples of how Eastern Health's dozens of programs and, more importantly, thousands of people personify its priorities. A strategic plan is only as good as the people who develop it, believe in it, connect with it, and whose actions bring it to life, who offer light along the way, who lead by example, who navigate together.